Back on Open Line on a Wednesday night. Let's get right back to our guests, Samni and Tracy here. Lucy covered a lot in her phone call, but what she talks about is the complications of navigating the system, which is another barrier for a lot of people. And you mentioned in the break too, now imagine being in a situation where you don't have a lot of money coming in, maybe English is not your primary language. It's difficult enough for regular everyday people to navigate the system and understand deductibles and whatnot. Because this survey did show 90% responded that they have some form of health insurance, but as we mentioned, really that's for you know, long-term, big-time issues. You still have to come up with a deductible and pay out of pocket for a lot more now than in years past. So it's another barrier, right?
Correct. They just keep adding up.
Yeah.
And in that within that 90% are different levels of coverage.
Of coverage, yeah. Exactly.
And so to keep that in mind. But I mean, that's a conversation that's been going on for several years. It's begun on at the federal state level. We know that recently quite a few people lost their insurance too. For us as public health professionals, access to care is very important. I mean, we like to look at public health as everything that happens before you have to go to the emergency room or the hospital.
Right.
That's what Tracy meant by the prevention. And access to care, health insurance is a critical part of that. So every time we can get more people insured, having access to care, we're pretty happy about that. It works for health. We don't get into the politics of it, but we know it works for health.
Yeah. Don't get into the politics of it, because then you'll never get anything done, right? As we know. Some other interesting, you talked about access, by the way, and we mentioned the Hispanic, Latino, and then lesbian, gay, and bisexual populations are less likely to be insured. The lesbian, gay, and bisexual population, 70% say they have some sort of health insurance compared to the 90% overall. Was that surprising for that group?
No, it's not. It's again, we threw out the word marginalized groups. That we see several health indicators where the LGBT community is kind of lagging in there. It's not surprising to me, but I mean, the part of our job is to work with that community and leaders. Again, even though it's not sufficient, I do want to repeat that if you come to the health department, we have people that are dedicated to helping you figure out the health insurance piece, and they work with you to do that.
Before our next break, I wanted to touch on mental health because it's so important, and this is fascinating. Some of the results here. Davidson County residents reported having 5.3 poor mental health days per month, I believe, in a 30-day period, involving stress, depression, problems with emotion. This outpaces the state average and similar-sized peer cities. It's far ahead. Like Austin is 3.3, Charlotte 3.4, 5.3. Women reported more poor mental health days, 6.2 per month, 4.3 for men. So we start to see a difference there. And then Nashvillians who never graduated high school self-reported more than 10 poor mental health days per month. Those who graduated or have a professional degree or a college degree, it's only 3.4. So we're starting to, you know, like you said, you can start to break down some of the demographics and see who's having more trouble.
Right.
Where do you even start with something like that as far as...
That, of course, we asked about stress and depression, and it's not surprising at all that women have higher levels of, reported stress and depression than men.
Now, let me ask you why that is. Is it because maybe a lot of women are juggling careers and family, or is it also maybe men aren't reporting?
It's both.
Okay.
It is actually
because I know men will say, I'm fine,
Exactly.
when really you're not.
Right.
Women are much more honest about it.
Women are much more honest, and they tend to take on that role as caregiver.
Yeah.
So if anybody in the household is going to worry about the money and express the worry about the kids and the money and the job and everything else, then it is mom. And
Yeah.
mom will be very honest with you and tell you. She will say, I'm fine, but then she will say, I'm fine, but.
Yeah, interesting. All right. So much information here. 737 plus. We got about a minute before our next break. If you'd like to call in, Lucy, thank you for your call. So, lawmakers, they getting copies of this?
We have not.
State level, local.
We have not made a direct, advance to the
Right.
legislature, state legislature, or to the Metro Council at this point. We're still trying to figure out who might be interested. Again, politics. There's been some change.
Right. Sure. Yeah,
Recently.
we've got new leadership.
So,
We've got a new mayor. We've got new council people coming in. But hopefully, just putting it out there will help and getting so
Yes.
people can start clicking on it and looking at some of it. We do have to take a quick break. We'll wrap things up with our guests right after this.